Upon arrival on scene, we determine that we have one patient. There are no bystanders on scene. The scene is determined to be safe and clear. We're going to begin to approach, and I'm going to do my general impression is that this is a middle 20s male that seems to be unresponsive. So we're going to continue to approach. We're going to put on our bodily substance isolation. In this case, it'll be gloves. We're going to approach. I'm going to direct my partner to maintain manual stabilization of the head and neck. And I'm going to go through AVPU. Sir, can you hear me? Are you all right? No response. I'm going to pinch the trapezius or the earlobe for a physical response. Again, I get none. Patient is unresponsive to physical stimulus. I'm going to begin my ABCs by checking the airway. The airway is determined to be clear. Had it not been, I would have cleared it or attempted to clear it and also used airway adjuncts as needed. Next, I'm going to check breathing. I'm going to monitor for the rate, rhythm, and quality. The patient is breathing adequately. Now I'm going to check the central and distal pulses. Again, I'm going to record the rate, rhythm, and quality. Next, I am going to do a chunk check to determine if there is any major bleeding. I determine that this patient is of high risk and in need of immediate transport, so I direct my secondary partner to go and obtain a longboard and cervical collar from the ambulance, while the other maintains manual stabilization of the head and neck. I'm going to begin my primary assessment, checking the orbits, mandible, maxilla, going posterior of the neck, anterior, sliding my thumb along the clavicle to the shoulder, then the other. Once I get to the other shoulder, I'm going to squeeze them together to determine stability and come back posterior to the scapulus. Check the sternum and the chest. Now I'm going to check for bilateral chest rise. The abdomen, I'm going to check all 4 quadrants. I'm going to check stability of the hips, down the legs, check the patella, all the way to the feet. Once I get to the feet, can you lift up? Can you push down? Can you wiggle your toes? Can you lift up? Can you push down? Can you wiggle your toes? Can you squeeze my hand? Can you wiggle your fingers? Can you feel me squeeze your hand? Can you squeeze my hand? Can you wiggle your fingers? Can you feel me squeeze your hand? At this point, my partner should be back with the cervical collar and longboard. So we're going to put on the cervical collar appropriately. My partner is still going to maintain manual stabilization of the head and neck as we prepare to log roll as a team. And put the longboard underneath. Log roll towards me on 3. 1, 2, 3. I'm going to check the posterior side, feel the spine, make sure nothing is out of the ordinary. Bring them back down. From here, we're going to secure the patient and bring him or her to the ambulance. From there, we're going to begin our secondary assessment. So I'm going to start with the head. Check the forehead, orbits, nasal, mandible and maxilla. I'm going to check the eyes for pupil dilation. I'm also going to check the ears for any cerebrospinal fluid or battle scars. I'm going to work my way down the cervical collar to the anterior side of the neck, where I'm going to look and make sure there is no jugular vein distension or tracheal deviation. One at a time, down the clavicle to the shoulder. Other side, down the clavicle to the shoulder. I'm going to press inwards. Recheck the scapula. Come up, check the sternum. Then to the chest. Now I'm going to listen for lung sounds. I will now check the abdomens again, to the hips. Can you wiggle your toes? Can you lift up? Can you push down? I will now check for capillary refill, the Babinski reflex, and I will also check the pedal pulse. Can you wiggle your toes? Can you push up? Can you push down? Capillary refill, Babinski reflex, pedal pulse. Can you wiggle your fingers? Can you squeeze my hand? Can you feel me squeeze your hand? Capillary refill. Can you wiggle your fingers? Can you squeeze my hand? Can you feel me squeeze your hand? At this point, I will get a blood pressure of the patient. At this point, my secondary assessment is complete, and we will reevaluate every 5 minutes or as need requires. We will also request a trauma unit to be on scene at the hospital when we get there, or ALS intercept.